Are you struggling with blood sugar management day after day? Finding it challenging to balance medications, dietary restrictions, and energy levels? What if there was a simple addition to your daily routine that could help support your diabetes management naturally? Research suggests certain herbal teas may offer beneficial properties for blood sugar regulation when incorporated into a comprehensive diabetes care plan. Today, we'll explore the most promising herbal teas for diabetes support, their potential benefits, and how to incorporate them into your wellness routine. 1. The science behind herbal teas for diabetes. Diabetes management involves multiple approaches beyond just reducing sugar intake. Various herbs contain bioactive compounds that traditional medicine systems have utilized for centuries to help maintain healthy blood glucose levels. Modern research is now investigating how certain herbs may help support insulin sensitivity, moderate post-meal glucose responses, reduce inflammation, complement conventional diabetes treatments. Let's look at some herbs with the strongest scientific backing. Second key ingredient, fenugreek seeds. Fenugreek seeds stand out as a thoroughly researched option for blood sugar support. These small seeds contain soluble fiber that slows carbohydrate absorption, compounds that may improve insulin function, nutrients that support metabolic health. Research published in the International Journal of Vitaminology and Nutrition found that fenugreek may help reduce fasting blood glucose and improve glucose tolerance. For tea preparation, use 1 teaspoon of seeds either soaked overnight or gently simmered in water. 3. Key ingredient, cinnamon. Cinnamon offers both flavor and potential health benefits. Studies suggest cinnamon may help improve cellular glucose uptake, provide anti-inflammatory properties, support cardiovascular health. A meta-analysis in the Journal of Medicinal Food found that consuming cinnamon was associated with significant decreases in fasting blood glucose. Add a small cinnamon stick or 1/4 teaspoon of powder to your tea for a warming, naturally sweet flavor. 4. Key ingredient, Gymnema sylvester. Gymnema sylvester, known as gurmar, sugar destroyer, in Ayurvedic medicine, has unique properties. Research indicates it may help reduce sugar absorption in the intestines, support healthy insulin production, temporarily diminish the sensation of sweetness. A study in the Journal of Ethnopharmacology demonstrated its potential in supporting beta cell function, the pancreatic cells responsible for insulin production. This herb can be found as dried leaves or in supplement form to add to your tea. 5. Key ingredient, bitter gourd, bitter melon. Bitter gourd contains compounds that research suggests may have glucose-lowering effects. Studies have shown it may support insulin secretion, improve glucose tolerance, provide beneficial plant compounds. The Journal of Ethnopharmacology has published multiple studies examining its traditional use for blood sugar management. For tea, you can use dried bitter gourd pieces or powder, though its distinctive bitter taste may be an acquired preference. 6th key ingredient, holy basil, tulsi. Holy basil is an adaptogenic herb with multifaceted benefits. Research suggests it may support metabolic function, help manage stress hormones that affect blood sugar, provide antioxidant benefits. A study in the Journal of Natural Medicines found that holy basil may help improve glucose metabolism and lipid profiles. Fresh or dried tulsi leaves add a pleasant aromatic quality to herbal tea blends. 7. Additional supportive herbs. Other herbs with preliminary research supporting blood sugar management include curry leaves. Studies suggest potential benefits for insulin function. Amla, Indian gooseberry, rich in vitamin C and antioxidants. Green tea contains catechins that may support metabolic health. These can be thoughtfully incorporated into your herbal tea rotation for variety and additional benefits. 8. Herbal Tea Preparation Guide. Here's a balanced recipe to try. Ingredients: 1 teaspoon fenugreek seeds, small piece of cinnamon, about 1/2 inch, 4 to 5 holy basil leaves, 1/2 teaspoon dried bitter gourd, optional, 1/2 teaspoon Gymnema sylvester, if available. Preparation: 1. Bring 2 cups of water to a boil. 2. Add all ingredients and reduce to a simmer for 5 to 10 minutes. 3. Strain and serve warm. 4. If desired, add a small squeeze of lemon for flavor. 9. Best practices for use. For optimal integration into your diabetes management plan, consider drinking in the morning before breakfast. Be consistent with your routine. Monitor your blood glucose levels regularly. Continue for at least 3 to 4 weeks to evaluate effects. Always consult your healthcare provider, especially if you take medications that may interact with herbs. Remember that herbal teas are complementary approaches, not replacements for medical treatment. 10. Comprehensive lifestyle approach. Herbal teas work best as part of a holistic approach. Regular physical activity, aim for 30 minutes daily. Balanced nutrition rich in vegetables, lean proteins, and healthy fats. Adequate sleep, 7 to 8 hours nightly. Stress management techniques, consistent medication schedule if prescribed, regular medical checkups. Small, sustainable daily habits often yield the most meaningful long-term results. Final thoughts. These herbal teas represent natural approaches that may support your overall diabetes management plan. While not miraculous cures, they offer potentially beneficial compounds backed by both traditional wisdom and emerging scientific research. Consider discussing these options with your healthcare provider to determine how they might complement your current treatment approach. If you found this information helpful, please share it with others who might benefit. Remember to subscribe for more evidence-based natural health information and practical wellness strategies for everyday living. Note: this content is for informational purposes only and not intended as medical advice. Always consult your healthcare provider before making changes to your diabetes management plan.